In this session, we are going to have a panel discussion on understanding human development and family relationships, relevance for counseling and family therapy. Joining me in the session are Dr. Renu Gulati. She is an Associate Professor in Child Development at the Institute of Home Economics, Delhi University, Delhi. Professor Manju Mehta. She is a Professor in the Department of Psychiatry, AIIMS, Delhi. Dr. Jitendra Nagpal. He is a Senior Psychiatrist at Mulchand, Delhi. And Dr. Vandana Thapar, who is looking after the Adolescent Guidance Center at Deputy Director of NIPSIT. Now, starting with the panel discussion and the theme. The basic knowledge that one needs to have in this regard is about the domains of development and the family life cycle. So let's cross this first milestone. So I hand over the mic to Dr. Renu Gulati to elaborate on these themes.
When we talk about an individual, we have to look at two major aspects. One is the domains of development, because when we are looking at an individual, we have to look at the individual holistically, but at the same time look at the various aspects of the developmental pattern. Of course, starting with physical changes at any stage of development. Then we talk about the physiological aspects, then social, emotional, cognitive development, language, which is also a very important aspect of development during the during growing years. Then, of course, the moral issues or the morality, which is also part of our development. And of course, we cannot miss personality. Personality is a very, it's a very wide aspect which includes social, emotional aspects of development. So when we are looking at the individual, we look at all domains of development, and that is one of the baselines of understanding of human development. And the second aspect that we need to look at is the life cycle through which the individual is going through. If we can approach life cycle from 2 points of view. First of all, see, when two young people come together, young adults, and then they think of starting a family, they plan a family, expanding the family, having one child, then probably expanding the family further, having another child. So at that stage, we are likely to have a family composition where the young adults, they have come together, having an infant, maybe having a preschooler or even later stages, then also having extended family sometimes where the parents are also living with the young couple. And then we move on to, when you have a young child, when you have an infant, there are going to be different kinds of role expectations from the new parents. They may have their own levels of issues, and then they have a child where they may have to have joint responsibilities. Then there's another child, if they have another child who's added onto the family. This child is going to grow older and the younger one coming in. And then go on to, say, from preschool years, this child is going to move on to the next stage, that is middle childhood years, what we call as middle childhood years, which is 6 to 12 years, and the younger child would be in the preschool years. And then further, we might have a family where the composition is such that we have an adolescent, we have a child, school-going child, and we have aging parents. And also this young couple is moving towards, if in their careers, in their own, they are growing older themselves. And then there's going to come there's going to be a phase of life where these adolescents are going to move away. And there's also going to be this whole syndrome which we are facing in the urban scenario, in most of the scenarios, where there's going to be an empty nest. And the children are moving away, parents are coming into the middle age, and there are going to be again redefinition of relationships. And then there might be a stage where they may lose their own parents, and they may be ailing parents, and that time the role expectations, everything changes. And then we have to also face the finality where you have moved into old age, you have moved into elderly, and the loss of parents, and the young children are getting married. The children, and then there's going to be again redefinition of family, whether it can be extended family, joint family, or again a nuclear setup. So when we look at human development, we have to understand all stages and all domains to be able to move on to what can be the various issues at every stage of development. So this basic understanding of human development helps. This basic knowledge is what's going to take us on to what are the variations that can occur, and what is normal and what is abnormal, which Dr. Mehta would be addressing.
Thank you. And extending the backdrop further, may I request Dr. Vandana Thakpar to talk about the cultural influences, the parenting aspects, as well as the changes that are coming about in the in family as an institution.
As far as children's development is concerned, they're developing in the context of their family, in the context of their community, in the context of their country. So, what kind of parents we are, it depends also on what kind of culture we are coming from. So, the earliest experiences of children within the family are very, very crucial. And this parenting which we are talking about depends also on the socio-historical context. Also, it is like culture plays a very, very important role. For example, in Indian culture, you will find a lot of emphasis on obedience. And why? Because we want our children to have a relational self, to be oriented, to be having close bond with the family. Whereas in the West, you will find a lot of focus on independence, because they want a separated self to develop. At the same time, while culture does play a very, very significant role, at the same time, parenting is also distilled through by individual experiences. So, for example, a mother, she has her own parenting. She has been parented, so she has her own experiences with her. She has her own occupation with her. She has her own education with her. So she co-constructs her style of parenting depending on all these factors. So the point is that when all these together, they form the beliefs of the parents, and these beliefs of the parents actually bring out the child rearing practices. So at every event, every point of time, when we are looking at parenting and we are looking at parenting issues, we also need to look at then two things. If there are any stressors, we have to look at the vertical relationship, which means that at the generational level, what this mother has gone through or what this father has gone through, what are their parenting styles, what kind of patterns have been there in their family. Is it a family where there has been issues related to acceptance of the child, issues related to violence, issues related to abuse, that also at that point of time when this mother is bringing up the child or the father is bringing up the child, there are certain horizontal stressors. So when both the vertical stressors and the horizontal stressors, they interact with each other. For example, my mother had difficulty in accepting me, and now I have given birth to a child and I have a whole lot of issues of accepting this child. So this whole situation will magnify my tension and my ability to do that role. So both these things have to be vertical as well as horizontal. This thing in the context of the family have to be looked into. So the parenting in India is also shifting from like earlier I had said that there was a lot of interdependence, but now it is like materially we are independent, but psychologically we are still interdependent. So there is even if we are nuclear family, in every family there is a jointness which is still there in our culture. So the kind of child rearing practices which we are now getting into is both control and autonomy. And the type of self which is developing now is both autonomous and relational. So now what are the factors which are the socio-cultural factors which are really changing and which are really influencing our parenting styles and the atmosphere within the family. So like right from the morning I think we are talking about changes in the gender roles, but along with this changes in the gender roles we are having a lot of family responsibilities which still have to be done by a mother, and where the mother is required, the alternative services for children, for the child care services are just not available in the country. So there are pressures. Similarly, there are a lot of families which are at risk. So there are families which are having certain internal events which are taking place within the family, which also in the session previous to this it was discussed that there are members, deviant members within the family. So there is also something like alcoholism, something like drug addiction, there is something like mental illness within the family. There are health problems, there is cancer, there is long-term health illnesses, there is unemployment. So all these stressors itself also, so I mean what we are trying to say is that parenting cannot be looked as a single linear kind of a relationship. Lot of other things which the parents themselves and the family themselves are going through are affecting parenting all the time, and there are the families are quite vulnerable, and at the same time the support which is required is not there, and the jointness is there, but the family sizes are shrinking, and with that the social support also from within the family is also becoming less and less. So these are some of our great challenges for parenting today.
My next question I'm going to pose to you, Professor Mehta. In a way, family therapy and counseling interventions are based on the premise of the normal-abnormal continuum. Now, we've just heard about the developmental perspective and the socio-cultural perspective. Keeping in view these perspectives, would you like to shed some light on this construal of what is normal, what is abnormal? When is a behavior at a particular stage of the life cycle for a human being deemed to be normal, and at which stage and under what circumstances does it become abnormal and therefore needing intervention?
Dr. Chadda, this is actually a very important question, because in our clinic we get lots of parents who many times think about a normal behavior of a child as abnormal. As it is, when we talk about normal and abnormal behavior, it is a continuum, and it is very difficult to draw a line between where the normality ends and where the normal behavior ends and the abnormal behavior begins. But when we are dealing with children, there are certain criteria. One of them is we take into account is age appropriate behavior. For example, a small 2 years old child, if he is throwing a temper tantrum, that is very appropriate for his age, because in early developmental period temper tantrums do take place. But if a 10 years old or 8 years old is throwing a temper tantrum, for example, you can imagine a 2-year-old boy, he goes to the market and he demands for a chocolate, and if the mother says no, he starts screaming, shouting, pulling his mother's sari or chunni, and he is screaming. So that everybody can understand. But if 8 years old or 6 years old is doing like this would be considered very abnormal. So age appropriate behavior is very important. Same thing happens like in adolescent period, lots of them, they they become little aggressive and they can throw anger. In that, when we take it, then it becomes also about the context in which it has happened. If the context is that if there is something the boy feels he was right and his parents think he is wrong and they are not trying to listen to him. So in that he is becoming angry. So that context would be something which would be determining whether this is normal or abnormal. If the anger is coming without any pretext, without any context, every small trigger is causing anger, so that would cause be another factor which we would think. Related to this is also about frequency and intensity of the behavior. If a boy is telling lies every time, so that becomes a problem behavior. If once in a while he has gone to school and he comes back and he tells, today I didn't get my report card, or he says that today I don't have homework, and it's only once in a while, it is all right. Similarly, once in a while, if a child has stolen little money from the mother's purse, it is once in a while, we would say that yes, it can pass off as a normal behavior. Similarly, there are lots of behaviors which it is because of intensity that we call it that this is abnormal. Now, if supposing the anger or aggression we are saying, the child goes on to the point that he is physically injuring another person, he is beating up and the other person is bleeding, so that intensity of anger becomes again abnormal. So intensity again would be something that we are going to consider into this. After this, we say what is the impact of that behavior on the growth of the child. Like we were mentioning that ADHD or poor concentration, these are certain behavioral problems. But if once in a while it is happening and then it has impact on the academic performance of the child, he is failing, he is not getting good grades in the classroom, he is causing lots of disturbance, other children are not able to tolerate, the teachers are not able to make him sit in one place, so impact on his growth would also be there along with frequency and intensity. Similarly, there are number of examples, like if we say sibling rivalry is one, which in early childhood when a new child is born, it's a normal thing which would happen. And even when in the middle childhood, if children are fighting between themselves, brothers and sisters or brothers, but if they are becoming aggressive, they are not looking at each other, not talking, not cooperative, they fight and they don't recover from that fight, that would be abnormal behavior. So whether we take anger or aggression or any of these problems, so we have to follow this criteria under which we say that yes, within limits it is part of the developmental phase and it is meeting all this criteria, then we would call it as abnormal, otherwise it's a normal behavior.
Thank you, ma'am. Various construals are important in the context of counseling and family therapy interventions. Two significant socio-cultural construals are that of the family life cycle and the individualism collectivism notion. We have with us on this panel Dr. Amiteshwar Ratra also, who's joined us. May I request her to shed some light on this aspect?
Thank you. Well, Mrs. Thapar was talking of having jointness in the so-called families now. I actually don't agree with her. When we talk of joint family system today, the individualism of Western countries is falling so much in. It is not the complete jointness when we are seeing the families today. Even the joint families have an individualistic perspective. They are living together, eating together, staying together, but still the outlook has changed. And in the need and respect and regard has changed. What was there earlier is not now. And so it has reflected into the family life cycle stages. Now the empty nest syndrome was never there in India. The older people were never alone when the children were married. Now the children are moving out. So this is a syndrome which is now catching up a lot in our country too. So I think so Mrs. Thapar would agree that we are now suffering from the problems which only the Western countries were suffering. So this, I think so, should be.
The processes of individuation, urbanization and westernization which the Indian society is currently undergoing are certainly making an impact in some way or the other, which have resulted in socio-cultural milieu to be in a state of flux. And that is what is contributing probably to the increase in the incidence and prevalence of the various mental health disorders and the cry for help signs that we see all around us. May I now request Dr. Jitendra Nagpal to shed some light on the issues and concerns vis-a-vis intervention.
Thanks, ma'am. I take the clue from Dr. Atra's very vocal comment on decontextualizing the whole approach to counseling and family therapy. Well, I understand that there would be a sentiment in what I say right now more than a rationality, because I think it's time we wake up to the decontent portion of it and contextualizing the whole aspect of how we are looking at the existence of the mind itself. Let me tell you, a client recently who's a lawyer told me that you people need to wake up to the needs of human rightist models of psychotherapy. I think that was a very, very wise comment from a lawyer coming to me. And I think it was in the context of how we need to depart from archaic Western models of maybe family and marital and maybe individualized therapies and look at how common sense approach to the context of culture in the Indian setting. For example, I'll tell you, the denial to the existence of a problem is not only vocal, but I think it is florid in our culture. And why not? Because protectionism of the family was probably the hallmark of any aberration of the mind, as Dr. Mehta said rightly, that the abnormality was a construct not even accepted by the individual. Today we find people coming forward, less of denial, more of rationality, and also less of resistance to accept the mind as a component of good health. And this is not only the urban setting. I come across a lot of rural client which probably would be more fascinated by the idea of seeking help rather than the most educated urban client, because the double standards, the stigma, the discrimination seems to be today and worthy of research. I recommend very strongly, worthy of research by teaching institutions to delineate this difference, why the hypocrisy of seeking help is much higher in the urban educated rather than the disinhibited rural plebeian of the Indian culture. Another example I want to say that yes, scapegoating effect, that you are the problem and I am the victim. Whether it is a couple, whether it is a child, or whether it is a joint family. It's like, I remember a child, 14-year-old, sitting across my table and requesting me that if these two can go out of the chamber, mummy and pop. And when they went out, he said, Doc, if they be all right, my life would be absolutely okay. Today I am a scapegoat. I am called names of disorders of a psychiatric nature or a psychological nature because the issue is about their own communication, from what we heard in the previous session, the roles and responsibilities. So if we take child rights, for example, health, safety, protection and participation, the 4 pillars of child rights, they apply to human rights also when I grow up as a human being. Are we taking that approach in marital therapy in Indian context? No. Are we taking that approach in the Indian context in family therapy? No. Why not? Because only when I am understood first as an individual in my rightist context will my mind be accepted in the collective context of a family. I think I am learning this from my own clients, and they are the best books, I thought. And we need to wake up to contextualize and bring in the stumbling blocks. My idea was to share some of the issues and challenges so that the people, just like typhoid, malaria, TB and tumors, they approach me for depression, anxiety and psychosis. So that the inhibitions are not about being accepted. The inhibitions are about even being advised what is right way to approach day-to-day life. Lastly, I think let's be proud. Let's be proud that human resource is the only biggest resource we have as an asset in our country. And unfortunately, it has still been underutilized in the context of counseling and family therapy. The primary health or primary education manpower at the school, college, hospitals and primary health centers still needs to wake up to the need of becoming basic counselors. Well, in a country where primary health center doctors are still not available, I can agree that yes, counselors is not a faraway approach. A course like this is really going to go miles ahead in the true objectives to generate first aid in mental health. To me, that is important. First aid in mental health to save the children, to save the families and to save the marriages also. Thank you.
Now, these were really thought-provoking words, and now the floor is open for interaction. the audience is welcome to make comments, ask questions.
Dr. Nagpal has said really what we need, in particularly in the rural areas and in each and every primary health center, in each district hospital, there must be counselor and family therapist, so that problems of the children, problems of the old aged persons, really that can be tackled. Thank you, sir.
Today I heard a lot of you in different sessions, and it's all been very insightful and I think brilliantly conducted and brilliantly put together. But the one question I'd like to ask all of you, you may think it's a little out of context, is why prevention? Why can't we inculcate some life skills in people,
That we are doing in this course.
No, we are doing a lot of interventions.
No.
Also, no, I'm talking of actual
Positives.
life.
As an approach.
actual
Yes, we
life
are using
skills.
it as an approach also.
Yeah.
Dr. Jitendra Nagpal has contributed a lot on this in
I
this
understand.
program of
I
study.
understand.
So the
But-
focus definitely is both,
Okay.
not just amelioration of the negatives, but promoting the positives.
Yeah, okay.
That definitely is a very conscious approach that has been adopted in developing and delivering this program of study.
Okay.
And development of life skills is an integral component.
Okay.
As you would go through the course material in the course of conducting the program,
Okay.
you would realize that what you're stating has been integrated and implemented.
Well, if it is, I'm really happy, because this is something that we've been
It
trying.
has been.
No, we
it
are
has-
talking
a
of
conscious, a very
positives and the
conscious
negatives.
effort has been made in this
put,
regard.
and that is something that is to be really cheered
Rest
about,
assured on
because
that.
yeah, because otherwise
Can I come in?
it's like a lot of interventions are happening, lot of negatives are being spoken about, but what about this?
Yes.
It's so important.
I think it's very well taken as a suggestion. Probably it was always in our sentiments to look at, yes, agreed that life skills as advocated by Gilbert Botwin way back in 1978, today has taken the realm of an ocean across the world. We may give it a different name that is agreeable to our culture, but actually it was meant, if you remember the evolution and the conceptual framework of life skills, it was not meant to substitute the word therapy. It was meant to widen the scope of therapy. And because it takes an ecological approach to life, not as an abnormality detection and its management. So agreed. I mean, in fact, I heard it from a teenager. He said that instead of psychotherapy, why don't you call it life skills therapy?
Yes.
Is maybe your view on it is about few years back when I used to talk to couples, they basically wanted to have one child, but today I find more of them are going into having only one child because of lot of factors. And I came across a doctor just about 2 months back when she said we have just decided not to have children. So when today here we are sitting here and talking about families, I would really love to ask the team, especially the panel, how do we see this? Like, where does family therapy, or when we talk to couples, when they are so prepared and educated couples, when they prepare themselves of not having a family of their own, what is your viewpoint on this?
Here I would just like to say one thing, because we deal with lot of adolescents. I personally feel we need to empower our young people. Somewhere it is they are scared, they feel they are not prepared. And recently I came across a young mother. She is very highly educated. She's a professional, and she's got a young child, and she just came up to me and said, "I'm a fantastic professional, but I'm a failure. I don't know how to handle my 3-year-old." And here, what Dr. Nagpal is doing, if we could have, along with our education in schools and colleges, if we could start with life skills, preparing them for dealing with, taking on responsibilities, not to be scared of that, probably that would help. And Dr. Nagpal has to do a lot more, along with all of us as parents, as teachers. We have to empower our young people to take on these challenges. Probably that will help, and we need to do something about it.
Is there some concrete, because being an educated, it becomes much more difficult counseling them, because as I mentioned, being a doctor herself, she had a lot of defense mechanism to prove her points of not having a child at all. And I really was amazed when one of my friends who really aborted a second baby because she didn't want to go through the same turmoil of going through a cesarean and have again a second child. And here we find lot of children being alone. When there are siblings, we find they learn lot of stuffs within themselves, Of course, there are a lot of positivity, but here, you know, when the child grows alone, there's a lot of other dimensions to it also.
It's a very interesting debate you have raised. I'm sure it has a full one-day seminar for it. Well, India at the moment is going to be the capital, the world capital for infertile couples by 10 years. And strangely enough, there are couples who don't wish to have babies. That contradiction itself is a part of something which I was just hearing ma'am telling me that yes, it's a matter of individual choice. So whenever couples like this come across, well, they're okay with one child or no child, it's up to their choice and they know the reasons, what are their priorities and goals in life. And maybe we as can go out of the box of our role of reformists or, you know, people trying to advocate what is science, that okay, perpetuating a family is one of the goals of life. The larger concern to me again would be, as ma'am has also raised, we are actually losing the grip of our young generation, and India is a young country. We have about 60 crores of people below 25 years, which is, let me tell you, Europe and America put together. That's what I heard in the WHO report. And the adolescents only is more than the entire American population. So, and we seem to be losing grip. Why I'm saying this? Because partly I'm talking about myself. I feel helpless and sometimes even go back on my chair when I see a defiant teenager in front of me. And I don't find answers because books have not yet taught me how to handle a difficult teenager of this time. And I would say that yes, even a course like this is a learning for me, despite being a contributor to it. The fact that let's understand life from the eyes of an adolescent, from the eyes of a child, their emerging needs and context, rather than our therapies and our context. Then I feel more comfortable with the client who is a young, you know, child or an adolescent. For example, the answer which many of the teenagers give us, I have seen only one world, sir. My parents have seen two worlds. My grandparents have seen three worlds. A world where there were only one Sunday movie and a Wednesday Chitrahar, coming down to 75 channels. So why am I blamed to be the brat? Teach me the methods to live life, what ma'am said, life skills. So I agree, completely agree that it's our duty to advocate a safe, secure, healthy environment for the next generation where they can be vocal about their problems. And if they're vocal, they actually will start getting disciplined also. We give them the space to be vocal. We give them the opportunity to express, participate in their own policies. I'm saying. Adolescents have demanded that if you're talking about adolescent education, why didn't you ask me? I don't need sex education as a priority. I need self-esteem as a priority. And we have been imposing sex education from an international mandate, which is not correct. And I'm very vocal about this because I support teenagers now. Because we didn't ask them that you need sex education as a priority. They said, I need self-esteem. You understand me first in a family and then talk about reproductive and sexual health. So maybe if we change our paradigm, I think counseling will become much easier. We see it from the client's angle who is a child or an adolescent, rather than completing a format of certain steps in counseling.
Also, I feel that is it the choices which we are making, or is it, as you said, that is it coming from some kind of inability to take on challenges? So I think a single factor which we all need to cultivate in our children is this challenging spirit of not getting defeated, and to be able to have that goal orientation, a goal which is true to myself, true to me as but nevertheless there will be challenges around those goals. To be able to take on those challenges, to not get defeated in the process, and for that I think the life skill education and the self-esteem which we are talking about, it is very important, and for the parents also to be able to understand that how important it is to to uphold the worthiness of the child so that his self-esteem is intact. So out of all the other things which the child may have or may not have, the single factor which brings in success in the future is the self-esteem. So positive self-esteem.
These are challenging issues which have been raised that I would request Professor Ahilya Raghuram also to make a comment.
You had raised regarding the choice of a couple to not have children. Now, when we look at this whole question from a national level, when you have a population of 1.2 billion, so perhaps a few people making a choice not to have a child is perhaps a good thing for all of us for the future. But on a more serious note, it is really a matter of personal choice. And in a sense, that brings us to the question of the need also to define the boundaries and limits of counseling and therapy. To what extent and to what kind of problems should therapy, and counseling, whether it is directed towards an individual or a couple or a family, to what extent and to what kind of problems do we need to take up for counseling, and what is it that we leave within the purview of the individual to make a decision? Sometimes I think as counselors, in our enthusiasm, we might tend to go a little overboard in terms of, wanting to help and guide people in making all their decisions, which I think is really undermining the capacity of individuals to think and decide for themselves. So I think to that extent we need to be cautious. And of course, the other comment I had was with regard to what Dr. Nagpal said, that particularly in family therapy sessions where there are adolescents involved, I've always found that no matter how aggressive or how bad, so to say, they are labeled by their parents, in the sessions very often they are the most honest people in terms of describing exactly what is going on in the family. Parents will often try to put on a facade of everything being all right, there are no issues, he's the one or she's the one who's the problem. And here you'll have this adolescent sitting there and unmasking them thoroughly. And one of the things, therefore, I always tell students is to pay very close attention to what the adolescent is actually saying in the session, because very often perhaps that reflects the true reality of what's going on in the family.
I want to say that it is not the trauma that the person he is facing of not keeping a child. It is because the person, nowadays the younger persons, they are becoming more career oriented and goal oriented, and because of that they don't want, and that is the primary choice that they make, and secondary is the family, and that is the reason they are not keeping 15.
This session has been so wide-ranging, so interactive, so enlightening and interesting that I won't even make an attempt to try and sum it up. So, thank you very much